On this evening before Thanksgiving, we welcome you to our Two on Your Side Town Hall. We have a big show ahead today. Thanks for being with us. I'm Michael Wooten.
And hi, everybody. I'm Kate Welshofer. We'll get to the questions you have sent us. And by the way, the easiest way to reach out is this number. You can text 849-2200. In a moment, we're going to be speaking with a critical care doctor and pulmonologist who is on the front lines here in Buffalo, helping save lives impacted by COVID-19. His message to Western New York.
Plus, quarantine questions. The CDC has recommended that you isolate for 14 days if you come into close contact with somebody who tests positive. But should it be fewer days than that? The change that could be coming.
And later, Dr. Fauci one-on-one. He talked with our parent company's national reporter, answering common questions that we've gotten from you, including when will the first vaccines actually be administered?
So when we look at COVID-19 in Western New York right now, it is a mixed bag. The infection rate seems to have leveled off, but it is still high, and we keep adding a lot of new cases.
And at the same time, hospitalizations are still on a steady increase with no signs of slowing down, and that is a concern. We'll take a look at the latest numbers for you right now. So we're now up to 337 people in Western New York currently in the hospital.
Yeah, you've heard us talk about this. What we do over the upcoming Thanksgiving holiday will determine how much additional spread there is in the community in the weeks to come. And as we look across the country, we are seeing that expected increase in deaths. The experts told us that this would happen. More than 2,200 Americans died from COVID-19 yesterday alone. That's up 60% compared to 2 weeks ago. And joining us live right now is Dr. Manoj Mammen, a critical care physician and pulmonologist with Kaleida Health. Doctor, I cannot imagine how busy you must be right now. Thanks so much for taking some time for us.
Well, hi, Michael and Kate. Thank you for having me. I think it's an important topic to discuss.
And we want to ask you, because we've seen this steady increase in hospitalizations. Can you just describe what the past week has been like on the COVID floors? What are you and your colleagues seeing? And what should Western New Yorkers know about how this surge is really impacting our healthcare system?
Well, this surge has happened slowly over time, and all of a sudden it seems like all the floors that are COVID units are full of patients. It takes a lot to care for a COVID-19 patient. The amount of personal protection a nurse or a physician has to wear, the extra protocols and steps you must do to keep yourself safe and keep other patients safe. So not only do you see the number of patients, but you see the nurses and technicians and medical assistants do extra work to keep themselves safe and keep the patients cared for.
Dr. Mammen, we've been trying to make sense of the hospitalization numbers as we look at them, because while we are going this increase in the total number, we are not seeing as many people end up in the ICU as a percentage as we did back in the spring. And of course, we're all thankful for that. But as we got some new numbers today, ICU admissions are increasing there. What are we to make of those current trends?
Well, I mean, we know that there's a lag between getting infected with COVID-19, getting hospitalized with COVID-19, and then eventually, unfortunately, getting into the ICU with COVID-19. We have made great strides over the last 6 months since we found out about COVID-19. And although the physicians and healthcare workers have learned a lot about COVID-19, I think it's the public awareness and knowledge about the disease that have stemmed the tide so far. And I'm still optimistic that we can still flatten the curve and hopefully flatten the admissions and the ICU surge by having partnerships with the public and helping to reduce the spread of COVID-19 this winter.
During the county executive's briefing today, he showed a model that predicts if we don't have lockdowns, we could see around 3,000 people in the hospital, so 10 times what we see now. He thinks with a partial lockdown, the hospital capacity will soon plateau. And we've seen projections get it wrong in the past, but we're wondering if you have seen any projections. Are you worried about hospitals getting overwhelmed in the near future, or do you think that we're getting a handle on this?
I do worry about the hospitals getting overwhelmed. And I'm not talking about the physical hospital. I'm talking about the people in the hospital, the nurses, the respiratory therapists, the medical assistants. Those are the people that I'm concerned are going to be overwhelmed. At a certain point, even though those individuals are doing their best and working their hardest, at a certain point, somebody's going to reach their limit. And so far, everybody's been doing a great job thus far and doing their best. But that's what we're concerned about. At a certain point, the healthcare workforce is going to reach the limit, not the hospital physical location itself.
Yeah, we've talked to administrators who have said they worry more about being able to staff. You know, you've got beds, but it takes doctors and nurses and all these other folks to be able to handle that. Can you take a moment and just share with us maybe what your Thanksgiving message would be with Western New York right now as we are approaching this holiday? A lot of people, despite the warnings, still have these plans for big get-togethers. What would you say to those people?
Well, you know, one thing I've been struck about Western New York since I moved here 10 years ago is the role of family in Western New Yorkers. Whether it's in my outpatient clinic or inpatient clinic, the family is what helps the patients do better and improve in their health. And in time of Thanksgiving, we're thinking about really family and how thankful we are for family. And that's the reason why we want to get together and engage everyone. And I think it's important to know if we really want to care for our family members, that we shouldn't interact with family members we have not been interacting for the last month or so. If you have not been engaging with those family members, by now engaging with them for Thanksgiving, you may be giving them a higher risk of getting COVID-19. Because as we know, many people are mild or asymptomatic with COVID-19. And although you may even get tested 2 days in the past 2 days, you never know if you're going to be affected at the time of Thanksgiving. So while the intent of getting together with everyone is admirable because you want to enjoy time with family, I think the best way to protect your family is not to expose them to COVID-19 and try to engage them in other ways than physically being there for dinner.
We talk a lot, Michael and I, about how we share this message every day, and it can be difficult to get it across, as we were just discussing. Can you give us, as being someone who is there with the patients, kind of a reality check for people? Because I think I've heard a lot of people say, we'll risk it. We don't mind risking it. Can you give us kind of a reality check of what these patients are really going through?
You know, I have a wide gamut of patients and their experiences, from those who are very scared and very conscientious about COVID-19, and those who may have thought COVID-19 was not a big deal, and they disregarded social distancing recommendations, and when they end up getting sick and be in the ICU, they are just in a very lonely and unfortunate situation, because not only are they sick, but they're sick in a situation where they're by themselves. We are in a public health emergency. They cannot have visitors, and their only last moments of consciousness may be a ventilator being put on their person to help support their breathing. This is very unfortunate. And as a healthcare worker, and with my discussion with other healthcare workers in the ICU, we always lament those situations. We always would wish that the patient and the public understands the serious situation this condition can bring upon you, and which I believe a lot of people have. It's just that for those who have not thought of COVID-19 as a serious disease, it has been a very serious disease, and it can happen to anyone, whether it's young or old, people with diseases, with people who are healthy, have been struck down with COVID-19. So it's something to be mindful of as a general caveat for the public.
We have been chatting with Dr. Manoj Mammen, who is a critical care physician and pulmonologist at Kaleida Health. We thank you again for your time. We know that you have so much going on right now, so we really appreciate your perspective and taking the time to chat with us. Have a wonderful Thanksgiving.
Have a happy Thanksgiving, and please, I'm looking forward to a happier New Year.
Happy 2021 for sure, all of us thinking that. Doctor, thanks so much for all you do. Let's turn right now to a question from a Two on Your Side viewer.
Alicia sent us the following. I have an essential trip scheduled. It's not just for fun. Should I stay at a hotel? I hear that some chains are better. What about an Airbnb? So Alicia, thank you for this question. We got some expert advice, at least in terms of hotels and what you can do to protect yourself.
First, call the hotel and ask about their COVID policy. Are employees wearing masks? Are there plexiglass barriers at the front desk? What are they doing to disinfect and clean the common areas and rooms? How often are they doing that? Once you feel comfortable with the precautions, focus on what you can do to protect yourself and your family. Always, always, always wear a mask in the lobby and anywhere else where you're outside of your room. Stay out of common areas like outside patios, indoor seating areas, pools, hot tubs, and gyms. Basically anywhere you can't social distance. You have no idea what those other folks in the hotel are doing to stay safe. Consider parking your own car instead of using valet. When you can, take the stairs. Skip the elevator or just commit to only riding with people from your household. It might take you a bit longer to get in and out, but it is safer that way. You might also consider wiping down and cleaning your own room. Just follow the same CDC guidelines that you would use in your own home. And if you order room service, just have them creepily leave it at the door and run away.
I like that. Just creepily leave it at the door and run away. But a good safety tip, because you get into these situations and you're just it's like muscle memory. You're like, oh wait, I forgot. It's something you have to take an extra step to think about.
I'm realizing I forgot to eat lunch. I wish we had room service here. I would run over to the door.
Creepily leave a sandwich on your desk.
Yeah.